The use of personal protective equipment, PPE, is essential in preventing the transmission of the pathogen that causes COVID-19, particularly in a hospital setting. The gear is primarily worn by members of staff who administer care to persons afflicted with the illness. At the Carl Houston Memorial Hospital, PPEs are acquired by procurement and donation, but the cost of replacement is borne by the patient.
I just want to be clear and to educate the public a little as it relates to the personal protective equipment. The charges is shown on the bill as a day charge for the PPEs. And basically what that means, for us a day charge is a 24-hour coverage in the hospital, no, for patients that are admitted.
On hand to provide the attention and treatment that is required is a patient care assistant who dons protective clothing, gloves, masks, and goggles for the better part of an entire shift.
It's hot. The suit is really hot, but it's fulfilling to help the nurses with the patients. Sometimes, you still get that fulfillment even if the patients meet their demise, because you know that you help the nurses do everything that we needed to do to get that patient to where they were before, that happened.
While PPEs do serve their purpose in safeguarding the wearer's body from certain hazards within the scope of occupational safety and health, they do come at a cost. That price tag has been an area of concern for those who access KHMA's services and have incurred an additional fee. Chief Executive Officer Michelle Hoare explains the shift system and how PPEs are used.
Each 24-hour is divided into two 12-hour shifts. And by standard, we have changes for PPEs, at least 3 changes per shift. Now, when we talk about PPEs, we are talking about a kit that is prepared before the staff member actually goes into the unit. A kit is prepared. In that kit, it comprises or it includes a full body suit with the hood, a goggles, N95, mask, 2 pairs of gloves, boots, right? So it's a kit that is prepared and the staff member will pull a kit.
For Donisha Castillo, a patient care assistant, wearing a PPE has taken some getting used to because it is confining. She started wearing them 10 months ago and has become a necessary part of her daily attire.
I just try to take in deep breaths and just do what I have to do, and once I'm done, I just come out of it. But we don't stay in it that long, just a great period of time, but we get used to it.
I gather that once you have donned your PPEs, using the facilities out of the question.
No, yeah, you can't use the bathroom. You can't use the bathroom until you're finished. So what we try to do is we go to the bathroom before we put on the suit.
During the course of a hospital stay, a patient may be attended to by multiple persons, each wearing a PPE. Those are all factored into the total expense.
It's not even 2 persons involved in your care. Sometimes it'll be 4 or 5 different individuals, and so when you multiply that by 4 times that you have to change in and out of the suits for the day, at least for 5 persons taking care of you, then that's where you see PPE as a cost comes up. So it's certainly not the cost of a mask, first of all.
The cost, according to CEO Hoare, is in fact calculated based on the number of changes during the 24-hour cycle.
The charges really is for actually 6 kits in a 24 hours, 6 changes per staff in a 24-hour period, right? Now when you break down the price per PPE that is used, look at $200 a day as is shown on the bill, and you break it down by the item that is included in the kit, we're looking at something like $6 and something cents per item.
Reporting for News 5, I am Isani Cayetano.